Hello, and thank you for joining us. 4. Social determinants of health, an impact on outcomes and quality measurements, as prepared by Group 5. Social determinants of health, or SDOH, as it will be referred to throughout this presentation, are basically non-medical factors that interact to influence a person's health outcomes and access to care. The CDC defines them as conditions in the places where people live, learn, work, and play that affect a wide range of health risks and outcomes. Specifically, social determinants include factors such as access to financial resources, what is the person's level of food security, education, and employment stability. Social determinants involve behavioral factors, including drug, alcohol, and tobacco use, obesity, and proclivity to engage in risky behaviors. Biology and genetics, both physical and psychiatric medical conditions and age, among others, and social aspects, such as gender identity, family of origin of structure, culture and beliefs, availability of support systems. Beyond impacts on health risks, health status and health outcomes, social determinants are known to influence the degree to which people are socially engaged in their overall sense of security and feelings of general well-being. Recent efforts by the federal government, nonprofits, and professional organizations have begun advocating for healthcare organizations to address these SDOH in tandem with servicing patients' medical needs. Examining what tools and methods exist for addressing social determinants of health and improving health outcomes, we seem to find that much of this area is still evolving. Over the past few decades, perhaps accelerating with the passage of the ACA and increasing focus on preventive health, social determinants research focused on making the case for the link between social factors and health status or outcomes. Although there is a lack of standardized terms, definition and models for nationwide use, progress is still being made. Tools and methods must be developed to make the data connection between things like poverty and harder to serve patients with chronic conditions that won't improve even though the provider interventions can be the same used on patients that might not live in poverty. This will help providers know what level of intervention is needed, whether it's a referral of services or services delivered directly to the home or follow-up calls and contacts from behavioral specialists and social workers. Electronic health records are being used to allow providers to populate patients' responses to questions around social determinants and financial matters such as housing stability, food security, transportation, and general affordability. This can be coupled with maps, census data, and other information so providers and other institutions can devise ways of positively impacting social issues in healthcare delivery. Only more recently has the federal government, through state Medicaid programs or Medicare, started doing more in the area of developing tools and methods for addressing social determinants of health. Since this area of study and treatment setting modification is still in work in progress, there's a fulsome picture of the toolbox for honing in on social determinants and using the indication of the existence to improve health or use financial incentives as leverage for improving social determinant factors and improving health. These tools and methods must be perfected to connect payment, quality, and other measures to advance this movement. Moreover, researchers have found that social determinants of health and the EHR, or the electronic health record connection, is an important piece to this puzzle. Researchers have found that nearly all patients screened had at least one social determinant of health need documented in EHRs across the country. Some of those social determinants of health that have been noted in the electronic health record tools are education level, financial resource strains, housing insecurity, food insecurity, exposure to violence, physical inactivity, social isolation or stress, alcohol use, and depression. All of these things would impact a person's physical recovery. The next question to answer is, how do we facilitate the change that needs to take place so that social determinants of health can be addressed at each and every clinic appointment? Change by law. That's how we do this. There are 4 avenues by which a law can influence shaping the lives and circumstances. So let's talk about those. First and foremost, laws can be methods through which behaviors and prejudice are transformed into distributions of well-being. Second, laws can be used to design and perpetuate social conditions that have adverse effects on individuals and populations. Third, these laws can be a contributor of poor health through their under-enforcement. Finally, the laws can be used to structure direct responses to health-harming social needs that result from factors like impoverishment, illness, market failure, and individual behaviors that harms others. There are 2 ways that the legal system can interact with social determinants of health. One, it can be a structure to help perpetuate the social conditions that we describe in our social determinants, or it could be a mechanism or a mediator through which social structures are transformed into levels and distributions of health more equally across all barriers. After patients' needs have been identified through the use of the electronic health records and the social determinants of health that are needed, providers can connect patients who need medical transportation, access to healthy food programs, and utility and financial assistance. There are infinite examples of the interplay between social determinants of health and patient health. One of the most frequently examined social determinants of health is a patient's socioeconomic status. Not surprisingly, research has linked lower socioeconomic status to inferior access to care and poor health outcomes. A recent study found that America's most poor citizens enjoyed life expectancies between 10 and 15 years shorter than those among the more affluent. To examine any one social determinant of health on its own, in a vacuum, would be misleading and inaccurate, since the interplay between the various factors is dynamic and ever-changing. For example, TalkPoverty.org reports that in 2017, 21.2% of all African Americans lived in poverty, while the white Caucasian poverty rate was 8.7%. In this simple example, we see that a population's ethnicity, race can easily become intertwined in their economic status, which in turn can impact their health and access to care. Beyond one's access to financial resources, a person's geographic location can influence their health. Populations who live in rural areas, in particular, typically have less access to financial resources, which in turn has a downstream effect, such as difficulty getting to and from medical appointments. Additionally, many rural areas have marked difficulties attracting and retaining medical specialists, forcing patients to travel further for specialty services and care. Geographic distance from specialists is problematic because it can dissuade patients from seeking the care they need due to inconvenience, expense, and time concerns. Treatment among providers who are not affiliated with the same health system and who are located a long distance from one another has a negative impact on healthcare provider collaboration, coordination of care, and also can have consequences for a patient's health. Luckily, efforts at electronic health record implementation and expansion are attempting to mitigate these factors. Accreditation agencies across the country are attempting to implement social determinants of health into the education requirements. This would encourage public confidence and trust in healthcare organizations and the professionals that seek to help individuals. The accreditation pieces won't be an easy task, however. It will be a delicate balance to find the varying healthcare professionals in organizations that would impact and still remain relevant to address all of these social determinants of health across healthcare organizations across the country. Together we can. We can overcome the socioeconomic barriers present in today's society that affect social determinants of health in our communities. A quote by Michael Merrimont: "Health inequalities and the social determinants of health are not a footnote to the determinants of health. They are the main issue." Thank you for joining Team 5.